The following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
Well, we want to talk about postpartum depression. We have Sarah Seymour here. She's a clinical social worker with the Behavioral Health Access Center at LDS Hospital. And postpartum depression, I think Utah has a lot of babies, right?
Yeah.
How prevalent is it?
So American Psychological Association states that it's about 1 in 7 women who can have it.
That's a lot.
It is a lot.
And can it range from pretty mild to pretty severe?
It can. The mild form is what we refer to as the baby blues. You can still feel unhappiness, overwhelm, but it tends to be, it tends to go away within a couple of weeks. Giving the mom a break, letting her have a nap, eating well can really help with baby blues.
Okay. But what about when it gets pretty severe?
Yeah, so postpartum depression, if a mom has a previous mental health illness or if her baby has a significant issue at birth, it can last up to about a year, and the mom can really suffer with self-esteem and inability to mother.
Okay, and the risk factors are we're looking at previous mental illness or family history, a stressful life event during pregnancy, and maybe medical complications for mother or baby. Those put you at an increased risk.
Absolutely, yes.
Okay, and what about treatment?
Okay, so what we look at is medication as well as therapy. We worry a lot of moms don't want to take medication. They're afraid it might do something if they're breastfeeding.
Right.
But there are medications that they can take, and we strongly recommend that they do that as well as engage in therapy, at least for a little while they go through this period.
And what are some of the things they should first look for?
Well, the worst is the psychosis. So if you know a woman's in psychosis, absolutely take her to the emergency room, get care as quickly as possible. But lesser than that, it can be inability to bond with the baby, feelings of worthlessness, possibly suicidal feelings, and even thoughts of harming the baby.
Okay, and these are some things that the mom might not notice and other people around her might.
Oh, definitely.
And they need to help her get help.
Definitely.
Okay.
Yes, that's very important.
Okay, and there's always help available. You can go to our website. We have a direct link to the Baby Your Baby program, and you have nurses and volunteers who are willing to help talk people through any problems.
And therapists as well.
Okay, thank you so much for coming in.
Sure, thank you.
All right, Matt, keeping an eye on